We're doing Obamacare. We're in final stages. We should be submitting the initial plan in March, early March, I would say. And we have to, as you know, statutorily and for reasons of budget, we have to go first. It's not like, frankly, the tax would be easier, in my opinion, but for statutory reasons and for budgetary reasons, we have to submit the health care sooner. So we'll be submitting health care sometime in early March, mid-March.
Oh, you heard it right there, the president saying that the replacement and repeal of Obamacare will be an initial plan out there early to mid-March. I want to bring in Scott Flanders now. He's the CEO of eHealth. They help you pick an insurance plan. I want to go back a little back in time here. Why is it that Obamacare did not cut the price and cost of health care?
Well, it didn't start with the consumer in mind, Stuart. It was a government-led plan. It was one-size-fits-all, set very narrow enrollment rules, and when they didn't hit their numbers, they missed them by over 50%. They relaxed it such that people could show up at the hospital and sign up for insurance when they were sick.
And that doesn't work, does it? That doesn't get the cost down. Now, your company, you did a survey of people who are using the Obamacare and Obamacare exchanges, I think, and you found that they liked the vague outline of the Republican alternative. Is that accurate?
Well, absolutely. 90% of our customers say they want more flexible benefits, and I would say that's the hallmark of the GOP plan, that it's permitting flexible benefits. Everyone wants to be able to choose the insurance that they buy. Why?
I know you can't really comment on your stock price, I know, but it is down today, down more than 1%. Are you affected by the death spiral of Obamacare?
Absolutely. You know, we have two segments of our business. We have a Medicare business that works for seniors, and that's growing very well. But on the individual market, healthcare.gov basically established a government monopoly that's making it very difficult for individuals to sign up for individual plans. And so what we're excited about in terms of the GOP plan is it abolishes that government monopoly with healthcare.gov.
So under the GOP plan, as you understand it, anybody can buy any plan they like issued by whatever state they like, and they come to eHealth to figure out which plan is best for them. Is that it?
Exactly. It should be as easy to enroll in a health plan as it is to order a plane ticket on Kayak. And right now, when you go through healthcare.gov, you can be put in a waiting line. The site breaks down all the time. Stuart, not to mention the $10 billion of taxpayer money wasted on building and advertising that site.
So the success of the GOP replacement plan is really all about a national market for health care plans. So that if an insurer is based in Connecticut, that insurer can offer a health care plan in California, and it can contain whatever health care plan or coverage they like. And that's where you come in, because you figure out which plan is best for a consumer.
Yeah, I mean, the service that we provide is we enable consumers to shop and compare and get the right plan for them. Right now, in 2/3 of the counties in the country, there are only 2 alternatives. And that's because the government has forced a one-size-fits-all solution. It just doesn't make sense.
So your company, now I know you can't comment on the stock price, but I would expect it to do well if and when Obamacare is repealed and we get this national health care market. Can you say anything about that?
Well, I would say that if the private sector competes, the consumer is going to win. You know, and our company is consumer-centric. We are the advocate for consumers. We are neutral. We serve up all the different options for the consumer, and then we put the power in their hands, where they get to choose the right plan for them, and then we get paid a commission from the insurer. Everybody wins with the GOP plan.
Okay, we'll see how it turns out. Scott Flanders, eHealth, thanks for joining us, sir. Appreciate it. Thank you.
Thanks, Stuart.